In this section, we will consider both the goals and phases of structural family therapy. Firstly, if we consider the goals, structural family therapists believe that problems are maintained by dysfunctional family organization. The ultimate goal of therapy is therefore structural changes to the family. These are changes in terms of roles, rules, hierarchy, and behavioral patterns. The structural family therapist would look at altering the family structure so that the family can solve its own problems, whereby in doing this validating the uniqueness of each family. The general goal of structural family therapy is to create or strengthen the executive system. If we consider goals in terms of the meshed family, the goal here would be to create more appropriate boundaries between individuals and subsystems. And if we consider the disengaged family, here the goal with structural family therapy would be to increase interaction by making boundaries more permeable. In light of these goals, when we consider the intervention process, therapy should begin with an assessment in which the entire family is interviewed and patterns of behavior are observed. Here the family counselor or therapist would look for example, enmeshment and disengagement. Therapists have two types of assessment tools which they can use in this assessment process. The first being enactments. Enactments occur when a therapist stimulates a family to demonstrate how they handle problems. The second tool is spontaneous behavioral sequences. Here, therapists guide the family on how to modify the enactments and create new options for behavior sequences. Creating enactments is like directing a play, whereas working with spontaneous sequences is like focusing the spotlight on actions that are already occurring. By observing and modifying such sequences early in therapy, therapists can avoid getting bogged down in a family's usual unproductive way of doing things. An experienced family counselor would develop hunches about a family structure even before the first interview. And this is a skill that you would develop as you gain practice in the arena of family counseling. If one considers the intervention process, there are a number of different skills in which the family counselor can use at the various stages of therapy. If we consider the opening phase, one skill in which the therapist would need to use is that of joining and accommodating. Here, the therapist would obtain acceptance from the family in order to disarm defenses and create an environment for change. Effective family requires both challenge and confrontation, and this is something to be in mind. Therapists at this stage would also work with interaction. This would be involving the use of enactments, which is the dialogues and playful or disciplinary interaction with children in order to observe how families relate to one another. In this phase, the family therapist would also look at mapping structural patterns. This involves observing enmeshment and disengagement. In Unit 1, we saw how genograms can be used for mapping relationships in an extended family. Consistent with this theory, structural theory also provides a method for mapping the structure of a family. The symbols used for mapping, consistent with this theory, provide punctuating boundaries as clear, diffuse, or rigid, and transactional styles as enmeshed or disengaged. As you can see, presented on this slide is the different symbols that are used for structural mapping. The variety of maps that can be used to describe the functioning and nature of interpersonal relationships within the families is endless. You can see a number of examples of this in your required readings for this segment. Structural maps show just a few possibilities. Regardless of the situation, however, it is important to consider issues relating to the developmental stage and to take note of all subsystems as well as the extrafamilial systems that may be involved with the family. Having focused on the open phases of therapy, we will now look at what we could term phase 2. Here, the focus is on the underlying family structure. The family therapist in this instance would look at first of all highlighting and modifying interactions. One way in which to do this is through the use of intensity. Here the therapist interrupts rigid and difficult patterns. Structural therapists achieve intensity by selective regulation of the effect, repetition, and duration. Tone, volume, pacing, and the choice of words can also be used to raise the effective intensity of statements. The focus of intensity is to block the stream of interaction. Another tool which a therapist can use is that of shaping competence. Here, the focus is on altering the direction of flow. By reinforcing positives, structural therapists help family members use functional alternatives that are already in their repertoire. The keys to this stage in particular is to help the family to do things with themselves, and therapists in this phase of therapy can invite family members to participate and interact in ways that will help them function more effectively. In the third phase of therapy, the focus is on the transformation of family structure. Here, the concept of boundary making is of key importance. A family therapist in working with disengaged families would focus on loosening boundaries, where a family therapist working with enmeshed families would focus on strengthening boundaries. Although structural family therapy is begun with the whole family, subsequent sessions may be held with individuals or subgroups to strengthen their boundaries. In boundary making, a therapist aims to realign relationships within a system. However, if the therapist's goal is to change a relationship within a system, they will then use the tool of unbalancing. The goal of unbalancing is to change the relationship of family members within a subsystem by joining a subsystem or an individual at the expense of another. Here, the therapist is seen as taking sides as a means to unbalance and realign the system, not as a means to take on the role of arbitrator of right and wrong for the particular family. Lastly, a family therapist can also embrace the tool of reframing. Reframing involves adding cognitive constructions to challenge unproductive constructions. Although structural family therapy is not primarily a cognitive approach, we can see that if we change the way a family views their situation, this will also enable them to change the way that they interact with each other.